This video is based on our latest blog article written by Similoluwa Oluwalana. It focuses on androgens and how the GlobalRPh atom calculator or the aging male symptom scale calculator can help with the assessment of lower values of testosterone. So, what are androgens? Androgens are a group of steroid hormones that play a critical role in the development and maintenance of male characteristics. However, they are also present in females at lower levels. The primary androgen, testosterone, is produced mainly in the testes and, in lower amounts, in the adrenal glands. This essential hormone regulates critical aspects of male physiology, such as muscle growth, voice deepening, facial hair development, and reproductive function. In addition to testosterone, other androgens like dihydrotestosterone, or DHT, and androstenedione contribute to male reproductive tissue's maturation and the maintenance of bone and muscle health. Androgens exert their effects by attaching to androgen receptors in various tissues throughout the body. They influence processes essential for physical development, libido, mood, and overall metabolic health. Although commonly associated with male health, androgens are vital for both sexes and influence a broad range of physiological functions, impacting everything from bone density to cardiovascular health. Normal androgen levels, particularly testosterone, vary significantly depending on age, health, and even the time of day. In adult men, typical testosterone concentrations range between 300 and 1,000 nanograms per deciliter, with levels peaking during early adulthood. However, this gradually declines by about 1 to 2% annually after age 30. Various factors influence this decline, including lifestyle, chronic diseases, and body composition. Morning is generally considered the best time for measuring testosterone because of its diurnal pattern, with peak levels typically occurring at that time. Levels below 300 nanograms per deciliter are often considered clinically low. Still, a complete evaluation also considers individual symptoms and baseline variations, as some men may experience symptoms of androgen deficiency even within the lower end of the normal range. Androgens, particularly testosterone, play vital roles beyond sexual and reproductive health. They are essential for maintaining muscle mass, bone density, fat distribution, and metabolic function. In men, adequate testosterone levels support muscle growth and strength, contributing to overall physical fitness and reducing the risk of sarcopenia, a condition marked by muscle loss that becomes more common with age. Androgens also promote bone mineral density, helping prevent osteoporosis and related fractures as men age. The bone-strengthening effect of androgens is critical in reducing the likelihood of age-related falls and fractures, which can impact older adults' quality of life and independence. Additionally, androgens aid in red blood cell production, which helps to prevent anemia, a condition often associated with low testosterone. Beyond physical health, androgens are crucial to a person's psychological well-being and cognitive function. Many studies have found that low testosterone levels are linked to a raised risk of mood disorders such as depression and anxiety. Cognitive decline has also been associated with androgen deficiency, with studies suggesting that lower testosterone levels may contribute to memory issues and decreased executive function in aging men. Androgens are also involved in cardiovascular health, with lower levels potentially contributing to higher risks of metabolic syndrome, insulin resistance, and cardiovascular disease. Thus, maintaining healthy androgen levels is essential for physical resilience and mental and metabolic health. The many benefits of these hormones underscore their broad impact on one's overall well-being. Androgen depletion, particularly the gradual decline in testosterone levels, is a natural part of aging for men, a process sometimes referred to as andropause or late-onset hypogonadism. Typically, testosterone levels decrease by about 1 to 2% annually after age 30 due to reduced testicular function and changes in hormone regulation by the hypothalamus and pituitary gland. This decline is influenced not only by age, but also by a range of lifestyle factors. For instance, obesity plays a significant role in androgen depletion because fat tissue converts testosterone into estrogen through aromatase. This enzyme is particularly active in adipose tissue. Furthermore, chronic illnesses like diabetes and metabolic syndrome have been linked with lower testosterone levels. It suggests that underlying health problems may accelerate the age-related decline in androgens. Various medications and lifestyle factors can also exacerbate androgen depletion. Certain drugs, including glucocorticoids and opioids, can suppress the hypothalamic pituitary gonadal axis, reducing testosterone production. Psychological stress and sleep disturbances can lead to increased cortisol levels, which may disrupt testosterone synthesis and further depress androgen levels. Furthermore, conditions that affect liver, kidney, or lung function can impact hormone metabolism and disrupt the balance of androgens in the body. Consequently, androgen depletion is not solely an outcome of aging, but also reflects the cumulative impact of lifestyle, chronic health issues, and environmental factors on the hormonal balance in men. Treating androgen depletion typically involves testosterone replacement therapy, often referred to as TRT. This therapy can be administered through injections, transdermal patches, gels, or subcutaneous implants, all aimed at restoring testosterone levels to a normal range. TRT has shown effectiveness in alleviating symptoms such as reduced libido, fatigue, low muscle mass, and depressive symptoms in men diagnosed with low testosterone, also known as hypogonadism. Studies indicate that TRT can improve bone density, muscle strength, and mood, all contributing to a better quality of life and functional health in men suffering from testosterone deficiency. However, TRT is not without risks. Potential side effects include erythrocytosis, which is an increase in red blood cells, possible aggravation of sleep apnea, and concerns regarding cardiovascular health. These risks necessitate regular monitoring and careful patient selection for therapy. In addition to TRT, lifestyle modifications are critical in managing androgen depletion. Exercise, particularly high-intensity interval training and resistance training, has been shown to boost natural testosterone production and improve metabolic health. Dietary adjustments, such as reducing sugar intake and managing weight, have been shown to support healthy testosterone levels. Also, sufficient intake of vitamins, especially vitamin D, and minerals like zinc can boost blood testosterone levels. Stress management techniques, including adequate sleep and mindfulness, can also help mitigate testosterone depletion. For some individuals, these lifestyle approaches may delay or even reduce the need for TRT. Typically, experts adopt a holistic treatment strategy for androgen deficiency. The benefits of an androgen calculator. An androgen calculator is a clinical tool for evaluating the likelihood of androgen deficiency, particularly in aging men. It provides a standardized and effective method for assessing testosterone levels and associated symptoms. These calculators combine objective measures, such as serum testosterone concentrations, with subjective symptom assessments to generate a score that helps healthcare providers identify individuals at risk for hypogonadism. This approach supports early detection and facilitates a more personalized evaluation of testosterone deficiency, considering variable factors like age, body mass index, BMI, and comorbidities, which can influence androgen levels and symptom severity. By integrating multiple variables, androgen calculators allow clinicians to make more informed decisions about whether further diagnostic testing or intervention is needed, ultimately improving patient outcomes. Furthermore, using an androgen calculator brings significant benefits in terms of patient management. They aid in monitoring the effectiveness of testosterone replacement therapy, TRT, or lifestyle interventions by providing a quantifiable method for tracking changes in androgen levels over time. It enables doctors to identify trends and adjust treatment plans, ensuring patients receive the most appropriate care. Moreover, the accessibility and ease of use of androgen calculators reduce the reliance on subjective symptom reports, which can be influenced by factors such as mood or general health perceptions. As a result, they promote more objective, evidence-based treatment decisions and reduce the chances of misdiagnosis, leading to more efficient management of androgen deficiency in clinical practice. The ADAM Calculator. The Androgen Deficiency in the Aging Male ADAM Calculator by GlobalRPh is designed to assess the likelihood of androgen deficiency, particularly in older men. This tool integrates subjective and objective measures and comprehensively evaluates testosterone deficiency. It takes into account factors such as age, total testosterone levels, and clinical symptoms commonly associated with hypogonadism, including low libido, fatigue, and reduced muscle mass. The calculator assigns a numerical score based on these variables, which helps clinicians evaluate whether further diagnostic testing, such as free testosterone levels or luteinizing hormone testing, is required. One of the key advantages of this calculator is its ability to facilitate early diagnosis of androgen deficiency, a condition often underdiagnosed due to the overlap of its symptoms with other age-related health issues. Incorporating various parameters, such as a patient's BMI and overall health status, into the assessment allows for a more tailored approach to treatment. ensuring that individuals with androgen deficiency receive appropriate interventions. The calculator can also guide clinicians in determining the potential benefits of testosterone replacement therapy, TRT, or lifestyle modifications. In this way, it provides a structured method for monitoring the progression of androgen deficiency over time and adjusting treatment plans accordingly, ultimately improving patient care. This tool is handy in populations where testosterone decline is typical. Still, it may be overlooked, aiding healthcare providers in making more informed, evidence-based decisions about treatment options. Further, also check out the GlobalRPh tool, the Aging Males Symptom Scale Calculator, which allows for a more quantitative assessment of testosterone deficiency compared to the AMS score. It consists of 17 questions that have been well validated and aid in the diagnosis of testosterone deficiency. The AMS can confirm the presence of symptoms that are associated with low testosterone, such as diminished erections, low desire, flushing, and sweating. The AMS can also help differentiate the primary cause of erectile dysfunction, for example, low testosterone versus vascular issues. Some limitations of androgen deficiency calculators: over-reliance on self-reported symptoms. Androgen deficiency calculators often rely on subjective symptom reports from patients, such as fatigue or mood changes, which can be influenced by other conditions, like depression or sleep apnea or general aging. It may lead to misinterpretation or overdiagnosis of testosterone deficiency. Standardized parameters. Many calculators use standardized parameters like age, testosterone levels, and BMI that may not fully account for individual variations in health status or the influence of comorbidities. It can limit the accuracy of the assessment for some patients, particularly those with complex medical histories. Limited to total testosterone levels. These calculators primarily focus on total testosterone levels, which may not reflect the bioavailable testosterone in the body. Free testosterone and other markers like luteinizing hormone or sex hormone-binding globulin, SHBG, are sometimes more accurate indicators of androgen deficiency. Still, they may not be considered in these calculators. Conclusion. Androgens, particularly testosterone, are vital steroid hormones that play an essential role in male development. However, the level of this crucial hormone can sometimes decrease because of aging or other health problems with significant health consequences. An androgen deficiency calculator like the ADAM calculator or the Aging Males Symptom Scale Calculator provides clinicians with an effective and reliable way to identify and assess men at risk of androgen deficiency. It also enables doctors to provide personalized patient treatment and monitor outcomes. Stay tuned for additional videos on this topic. If you enjoyed this video, please like and subscribe to be notified each time we release a new video.